ready to get started?
Yep, already.
Elaine and Samantha, are you ready?
All set.
Ready.
All right. Good evening, everyone. Thank you so much for joining us. My name is Rena Lachlan, and I'm the Program Director of the Epilepsy Foundation, Eastern Pennsylvania. I'm so excited that tonight we're going to be introducing you to the Hopscotch program that we recently became involved with over the past few months. Hopscotch stands for Home-Based Self-Management and Cognitive Training Changes Lives. Hopscotch is a self-management program designed to help people with epilepsy find ways to manage and cope with their memory problems in order to lead a happier, more productive life. Tonight, we have Dr. Elaine Kiriakopoulos and Samantha Schmidt from the HOBSCOTCH Institute at the Dartmouth Hitchcock Epilepsy Center to talk with you about this program. Next up is Seamus.
Good evening, everyone. And as Rena said, thank you all so much for joining us tonight. We're very excited for tonight's webinar. My name is Seamus Morgan, and I am the Greater Philadelphia Resource Coordinator for the Epilepsy Foundation, Eastern Pennsylvania. As Rena mentioned about the Hopscotch program, we're very excited. In just the past few months, we have started to partner with the HOBSCOTCH Institute to bring this program to our local community. After the webinar tonight, if you are interested in either becoming a participant or memory coach with the Hopscotch program, you can reach out to me by email or phone, and I will share our contact information at the end of tonight's webinar. At this time, I'm going to launch a poll with a few questions. If you could just take a moment and please fill it out, we would greatly appreciate it. And there will also be a post-test as well, too. While you're completing the survey, I would like to introduce our two guest speakers tonight, Dr. Elaine Kiriakopoulos. She is an assistant professor of neurology at the Geisel School of Medicine at Dartmouth and the co-director of the Hopscotch Institute for Cognition. And I would also like to introduce Samantha Schmidt. Samantha is the project coordinator for Hopscotch Institute for Cognition and is also the project coordinator for Managing Epilepsy Well Network. Thank you both so much for joining us tonight, and I will turn it over to you two at this time.
Great. Can I go ahead and close your poll? Is that okay?
Yes, I'll end that now for you.
Okay. Perfect. Thanks for having us. It's super to be here with everyone this evening and to share with you a look at really an innovative telehealth solution that's helping to meet the needs of people living with epilepsy and cognitive challenges, and that's the program Hopscotch. I want to take this opportunity to thank Rena and Seamus for hosting tonight's webinar and letting us join your amazing epilepsy community this evening. We're so glad that they're partnering with us at the HOBSCOTCH Institute to bring you this intervention that can help you to build skills to help with challenges around thinking and memory. So here we are with our pre-pandemic hair in these in these photos. So glad to be joining you this evening. There are no disclosures for tonight's presentation. So we have a lot to get through, so let's have a quick look at how we'll spend our time together. We'll begin by considering the effects of epilepsy and its treatment on cognition. And this will lead us to discussing what it might be like to participate in an epilepsy self-management program. And the one we're sharing with you today directly targets cognitive challenges called Hopscotch. And as we discuss Hopscotch, you'll be introduced to problem-solving therapy and compensatory memory strategies that the program uses to help with cognitive challenges in epilepsy. And then finally, we'll head towards our ending thoughts around targeted innovative solutions and building skills that you can participate in creating to help you take control of day-to-day life. Let's quickly review what the word cognition reflects. So cognition, simply put, refers to thinking. Cognition also encompasses the mental functions by which knowledge is acquired, retained, and used. The term covers a wide number of functions that we all perform every day, and included under the umbrella of cognition are memory, learning, attention, language, and executive functions like problem solving, judgment, planning, and it also includes things like our perception and our imagination. So all of these functions are carefully balanced in our brain to help us build our knowledge and understanding of the world around us through thought, experience, and our senses. While some cognitive processes are carried out consciously and deliberately, others are carried out unconsciously and automatically. Now, let's think a little bit about what are some of the key factors that can affect cognition or thinking in people with epilepsy. The first being ongoing seizures. The second is the underlying cause of the epilepsy. And we know that in nearly half of people with epilepsy, we can't figure out what the cause is, but it's generally accepted that there's likely some form of either an injury to the brain or a genetic predisposition that contributes. With advances in brain imaging and genetic testing, we're learning more and more about underlying causes. So that's very hopeful. The third key factor relates to the treatment of epilepsy. And this principally refers to what is a familiar experience to many patients, and that is medication side effects. So we'll spend some more time on each of these factors throughout tonight's presentation. Throughout our discussion, it's important for us to remember that epilepsy is a diverse disorder, that clinical outcomes in epilepsy are diverse as well. And so it makes perfect sense then that cognitive profiles, so how each person with epilepsy thinks, is also diverse. Not every person with epilepsy will have difficulty with cognition. And for those that do, the type of thinking or remembering problems they experience can differ. However, what we do know is that there have been a large number of clinical studies and surveys done over time that have helped us to learn that many people with epilepsy do report being impacted by cognitive challenges. So I'm sharing with you here a survey of 425 Europeans living with epilepsy done by the International Bureau of Epilepsy. And through that study, we learned that almost half of the group reported difficulty learning and slow thinking. And about 6 out of 10 people reported getting tired or sleepy related to their seizures or their epilepsy. 63% felt medication side effects were limiting and prevented them from achieving their goals. And more than half, about 6 out of 10, had asked their healthcare provider if something could be done to reduce the cognitive effects of their epilepsy and its treatment. We also know that both children and adults report memory and thinking difficulties frequently, and that subjective memory complaints are more than twice as common in people with epilepsy as compared to the general population. We also know that how epilepsy affects a person's memory and thinking can be complicated by a wide variety of factors, including things like anxiety and depression and other medical or psychiatric illness. One very important reason for clinicians and researchers to try to strive to make some progress is because studies have shown that if a person is living with epilepsy, cognitive challenges directly impact how that person regards their quality of life. Let's talk a little bit about the cognitive function of memory, because the Hopscotch program you will learn about directly targets memory and thinking. So when you ask people, both those with and without epilepsy, what they mean when they say they're having memory problems, you'll hear a really wide variety of responses, and you can see some of the common things shared listed here. People may reference misplacing items, or being unable to remember lists, or getting lost, or forgetting names as examples. People really reflect on their memory issues many different ways. If you try to narrow things down when talking with someone, it may be their symptoms are related to having difficulty truly remembering things. So forgetting appointments or names or conversations, forgetting to take a medicine, or forgetting something they've already done and repeating it, or going back to check to see if they actually did something. This, of course, can bring a good deal of frustration. For some people, their symptoms seem to fit more along the lines of having trouble paying attention or focusing. And they might share that they have to reread pages or paragraphs that they've already read, or that they find themselves not finishing tasks or leaving out steps and missing details. And often this type of trouble surfaces with either poor performance at work or school. For some people, they share that their biggest difficulty when it comes to thinking has to do with planning or organizing that's influenced by their memory. So they might have trouble planning their time or organizing their day. They might miss scheduling important tasks. They often will find it difficult to multitask or to deal with a new issue when it arises. And often they'll express feeling overwhelmed during even a normal routine day, whatever that day might entail for them. Another important thing we've learned over time is that the correlation between self-reported memory problems, so what a person feels is happening with them, and formal neuropsychology testing results are low. They often do not match. This chart shares an interesting comparison of subjective thoughts patients and caregivers often share about cognition, and compares it to what we've learned through scientific research. So let's walk through this a little bit together. So you'll see listed under the patients and caregivers may think side, my memory is fine. And if we compare that with what research shows, is that those who subjectively feel they have no impairments may actually have the most impairments. If we go to our bullet number 2 here, my epilepsy or treatment of it has significantly worsened my memory or concentration. What research shows us is those who worry about cognitive problems often have none on testing. If we go to the third point, I had memory problems before I ever had a seizure. If we look at the research, it shows that memory problems may exist before seizures begin. I can't remember what happens during or right after a seizure. Research will show us that seizure activity can affect memory, but exactly how is not well understood. The longer I've had epilepsy, the worse my memory and concentration have become. We look at what research shows us. It shows us that memory problems can worsen with prolonged epilepsy, and especially with poorly controlled epilepsy. And then the last point under patients and caregivers may think, my epilepsy medications make it more difficult to remember and concentrate. What research shows us is that many anti-epileptic drugs have some effect on memory, but this is less true of newer drugs. So that's an interesting comparison of what people subjectively think and what research has shown. We talked briefly right at the very beginning, you remember those 3 colored boxes about key factors that can influence thinking and memory. And I wanted to share with you in a little more detail around some of the causes of cognitive problems in individuals with epilepsy. And to orient you to this graphic, what you're looking at is what we call in neuroanatomy or brain anatomy, a coronal slice through the brain. So if you imagine starting at the tip of your nose and going to the back of your head, making slices as you move backwards, just like a loaf of bread, this slice would be located somewhere near the middle. So let's start with the rose-colored text. Structural factors, which generally speaking are largely irreversible. So structural factors include things like lesions that have the potential to progress, such as a tumor or an infection like encephalitis. A person can also have a stable lesion that contributes to the problem, and these can be things like a scar caused from a traumatic head injury or a congenital malformation of brain tissue. And finally, in this column, we have epilepsy surgery, which may contribute to cognitive issues post-operatively in some, but not all cases. This is very dependent on the region of the brain and the degree of cognitive deficit already present before surgery, and any other structural changes that may be present. Now, if we look in the center, in the navy column of clinical factors, things to consider include the location of the epilepsy focus. So where is it in the brain that seizures are coming from? The duration or the length of time someone has had epilepsy, the type of seizures a person has, and whether or not the person has had one or more episodes of status epilepticus. Now, if we move over to the third teal-colored column of text, you see a list of functional factors which are considered largely reversible. So this includes things like anti-seizure medicines, and they're reversible in the sense that if someone were having side effects to one medicine that was impacting their ability to remember or think, they could try another or adjust the dosing with the help of their doctor. Psychiatric comorbidities are also treatable and potentially reversible as well. And finally, seizures and interictal discharges. So people with epilepsy will frequently have what we call interictal discharges, or epileptic, sharp, or spike and slow waves seen on EEG. These pathological discharges are frequently seen in between seizures and occur in and around the seizure onset zone. So both seizures and these abnormal discharges are both potentially reversible with the appropriate treatment. Now, I'm just going to touch also briefly on anti-seizure medicines and cognitive function. And that is to share that there are some medicines which are considered more or less favorable when it comes to their influence on a person's memory or thinking, or their processing speed, or their language, for example. But remember, every person is different, and their response to medication may be the opposite of what is listed here. The key is, if you feel you're having side effects affecting your thinking, you need to make time to speak with your doctor about that and approach a change in medication safely with their medical guidance. I want to point out, when it comes to cognition, it's not always the fault of seizure medicine side effects. A study of 247 people with newly diagnosed epilepsy who had not had any medication prescribed yet demonstrated on formal testing that about half of them had memory, attention, or executive function problems. Interestingly enough, about half of the people with the problems were completely unaware of their deficits. The study noted that there was a higher risk for cognitive problems if a person had generalized tonic-clonic seizures, if there was an underlying brain lesion present, or if the person had a lower educational level. And why is that important? This study highlights really that neuropsychological testing early in the course of a diagnosis of epilepsy should be discussed, as it can help to set an accurate baseline for testing down the road if a person notes new problems or changes in their thinking. And just to point out what you might expect, that anti-seizure medicines have positive as well as negative effects on cognition. Remember, if they're helping to control a person's seizures and suppressing interictal discharges, it can very much positively influence a person's thinking and memory. Let's pause here for a moment to reflect on what we've discussed so far, and I know it's been a lot of information. What things can a person do to help improve their memory and thinking? So monitoring seizures and seeking treatment for uncontrolled seizures is important. Both clinical and subclinical seizures need to be treated. So clinical seizures are the ones that a person is aware of, and subclinical ones are the ones a person may not notice, but that might be recognized on an EEG. Adherence to medicine is key, and remembering to keep a close eye on any other medication, not necessarily just your seizure medications, that might potentially be affecting your thinking. Taking care of your general health, both physical and emotional, is critical. And finally, in thinking about taking care of doing all of these different things, where can a person turn? Considering a program like Hopscotch is a great place to start. And with this point, I'm going to transition to share with you more about self-management, epilepsy self-management, and the Hopscotch program that can support you and will allow you to think creatively and innovate solutions that work for you, allowing you to feel more in control. Some of you might be thinking, why should I consider a self-management program? What can it do that my doctor or nurse can't do? I need to yield here before I turn this corner and commit to trying something new. Let's think about this together, sharing some background about how we've received healthcare for our various conditions just in general. So we've learned over many decades that the traditional medical model, which has historically focused on managing a specific disease condition as opposed to managing the whole person, has proven to be both ineffective and expensive in the treatment of chronic diseases. This is, of course, because many people have more than one chronic condition, but also because competing life circumstances can impair a person's capacity to self-manage their disease. These limitations of the medical model have led to innovative new and evolving chronic disease treatment paradigms that require a patient and provider partnership and involve collaborative care and education in chronic disease self-management to ensure the best possible health outcomes and quality of life for patients. A significant proportion of unnecessary healthcare costs and poor health outcomes associated with the treatment of chronic diseases results in a large part from the failure of patients to effectively self-manage their conditions in response to recommended medical therapies. So if the management of chronic diseases is to be advanced, healthcare providers and systems of care need to integrate patient self-management to increase the capacity of patients by providing them with knowledge, resources, and skills to perform the multitasking that's necessary to self-manage their condition. For this to happen, it requires building on and tailoring what is already known to be effective, and sharing evidence-based programs and practices within and beyond the clinical setting. So in settings like this one tonight, in the community, by working to share self-management the possibility emerges that people will be enabled and supported to manage the chronic diseases and challenges related to those diseases in the context of their homes and in their diverse communities. Substantial evidence of the effectiveness of chronic disease self-management programs has accumulated for several chronic diseases, including epilepsy. Interventions that have been provided by these programs have been shown to influence a wide range of outcomes. Now, we're sharing one program with you this evening that targets cognition. But evidence for the impact of epilepsy self-management programs has grown over the past decade, with over a dozen randomized controlled trials that support the benefits of self-management interventions and their ability to improve both health outcomes for people with epilepsy and also quality of life. In order to manage epilepsy well, we know that a person has to juggle many different aspects of their unpredictable disease, their treatment, and the practicalities of day-to-day life, as well as their medication side effects and other comorbid illnesses. In short, it's no small task to manage epilepsy well. So at this point, I'm going to turn things over to my colleague, Samantha Schmidt, so we can take a closer look at hopscotch together.
Great, thank you, Elaine. So I'm going to start our discussion specifically on the Hopscotch program and kind of start us off with an overview. So again, Hopscotch stands for Home-Based Self-Management and Cognitive Training Changes Lives. Next slide, please. So Hopscotch was developed by Dr. Barbara Jobst, Dr. Tracy Culler, and others as part of a work group at Dartmouth Hitchcock Medical Center. It was funded by the Centers for Disease Control and Prevention through participation in a group called the Managing Epilepsy Well Network. And this network is part of an even larger CDC initiative which funds prevention research centers, which focus on studying public health and preventative medicine. So this Hopscotch program was created with a couple of key collaborators who allowed components from their own programs to be adapted for Hopscotch. These collaborators include Dr. Robert Ferguson and the MAT, Memory and Attention Adaptation Training Program, as well as Dr. Mark Hagel for his work in problem-solving therapy. So Hopscotch is a self-management program designed to treat cognitive symptoms and improve quality of life while minimizing barriers of access to care. So Hopscotch is what we call a self-management program, and you've heard that term a lot already. So here is one definition on the screen for you for epilepsy-specific self-management. So broadly speaking, epilepsy self-management is the sum total of steps taken and processes used by a person to control seizures and manage the effects of a seizure disorder. Epilepsy self-management includes controlling the seizures themselves, but also managing the other effects of a seizure disorder. Things like memory problems, low mood, medication side effects, and many more. But a key thing to know is that a single person can't do all of this alone. Successful self-management involves a partnership between a person with epilepsy, the person's healthcare provider, and family and friends. So getting back to Hopscotch, I'd like to share with you some data. And it's important for you to know that Hopscotch is what we call an evidence-based program. This means that the program was studied in a structured way to provide data to show that it is effective. So our first study was called Hopscotch Phase 1, and it was conducted at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire, and it included 66 adults with epilepsy who were randomized into different cohorts. The study found that the Hopscotch program improved quality of life and objective cognition, primarily in the domain of attention. So what you see in front of you is a bar graph showing those results. The blue bars represent the group that got the hopscotch intervention, and the green bars show the control group that did not get hopscotch. So moving from left to right, you can see the change in the average scores for our measure of quality of life using the quality 31, our measure of cognition using the R bands in the middle, and depression measured by the PHQ-9 on the far right. Both quality of life and cognition showed improvements that were statistically significant. On the far right, there was an improvement in depression scores, but it did not reach statistical significance. So our second study, we call Hopscotch 2, and the goal here was to see the same results at other epilepsy centers. So we partnered with Maine Medical Center, the University of Vermont, and the University of Massachusetts Medical Center. So we are still working on analyzing all of the data and writing up those results, but we can share with you some interim results. So what you see here is a graph showing a comparison of the quality of life scores for both the Hopscotch 1 and Hopscotch 2 studies. You can see that both groups that received hopscotch had improvement in scores, and both of the control groups declined in their scores for quality of life. So moving away from the data, the Hopscotch program is for adults with epilepsy who have cognitive difficulties. So participants should be motivated to learn new skills and strategies. And these strategies focus on 3 key areas: organization skills, disease management skills, and social skills. The program is delivered entirely remotely, so it can be done from home using a computer and a telephone and of course the internet. And you can register to participate in Hopscotch by emailing us directly at newprograms@hitchcock.org or by contacting Seamus. So what you see in front of you now is the structure of the program. So the program consists of 8 sessions, which are delivered weekly. Session 1 is conducted either in person or online using a computer and a webcam. The first session lasts about an hour and a half, and sessions 2 through 7 are done just by telephone and last about 45 to 60 minutes. And the final session, session 8, can be done either in person, virtually, or by just telephone. So each participant in the program receives the following materials. They get a workbook, which includes education materials about memory and epilepsy, problem-solving worksheets, and a memory toolbox of compensatory strategies. They also receive audio files of relaxation exercises and a day planner and seizure diary. And with that, I'm going to pass it back to Elaine, who's going to talk to us more about the different components of the program.
Thanks so much, Samantha. So we're going to swing now from the science to look at the real world solutions that Hopscotch can help you find. So let's move on with that, starting with the program components. And so it's important to note that you'll be working with a coach one-on-one to make your way through these different components, and you'll keep that same coach with you throughout the course of the program. The key components in Hopscotch include epilepsy education, and Hopscotch education will teach you the basics of memory and how seizures and other variables related to epilepsy, many which we talked about early in this presentation, can impact memory and cognition. It'll also provide you with learning around self-awareness training. And self-awareness training really is just what it says. It teaches people to be aware of the multiple influences that can impact their memory and their attention. And these can be external factors, things like noise or distractions, but they can also be internal factors, things like hunger or fatigue or stress. And self-awareness training and learning how to do that can be very, very helpful in targeting strategies to improve your memory and thinking. Problem-solving therapy is a big component of this program, and it's a form of cognitive behavioral therapy. And what it does is it provides you with skills to systematically work through cognitive difficulties, so memory and thinking difficulties, and real life problems. So how is it that your difficulty with thinking and memory is impacting you from day to day? And how can you create solutions to make things better? The program also shares compensatory strategies, and these are strategies used to aid in improving day-to-day function. It gives you what we call a memory toolbox as part of your workbook. And in that toolbox, there are tried and true strategies that provide practical skills that help people to feel in control of cognitive challenges. And we're going to give you a few examples of these tried and true practical skills in just a little bit. So when we think about epilepsy education that comes as part of this program, you'll learn things about seizures, about different types of memory. You'll learn about the anatomy of memory and where different types of memory are stored. And how that relates to where your seizures come from or how your seizures spread, if that's the case. And what it really does is helps you to better understand your epilepsy and why you may be having difficulty with a particular type of memory, and how to really think about solutions and strategies to target that. So this slide is an example of the type of education that you'll hear about as part of the program. And so, what's necessary for our memory to function? And this is an example of a simplified way of considering the process of making memories. There are three main stages we know to making memories: encoding, storage, and retrieval. And so encoding is when you're actually attending to a task at hand and trying to understand and process that information. And in this example, that would be this gentleman observing that yellow folder. Storage is then taking that information that you've been encoding and storing it away in your brain so that you can access it later. And in this example, that would be taking that yellow folder and putting it in the filing cabinet for storage. And the final step of memory is the retrieval process. It's being able to go into that filing cabinet, into that storage area, to find that memory that you've previously made and bring it back into your awareness when it's needed. And so in this example, that would be going back into the filing cabinet to look through and retrieve that yellow folder. Now, I know that this example is quite simple, but its purpose is to show you that a disruption at any point in this process can result in a memory problem. So if you have trouble attending to things, you won't be able to encode them properly, and that memory will never be made. If you have trouble storing things, you can understand the information at first, but it won't ever get filed away, and so then it won't be there later when you really need it. Finally, if you have an issue with memory retrieval, and the memory is stored in your brain somewhere, but you aren't able to get back to it and take out what you need, that's a problem. And people tend to find this last issue particularly frustrating. all of this is really important because if we can figure out, or if you can figure out as you're working with your coach, where the disruption in the process is for you, it'll help to better develop targeted strategies to overcome it. Strategy for overcoming an encoding issue is going to be totally different than a strategy to overcome a retrieval issue. And so moving on, we're going to talk a little bit about the self-awareness training component that I had mentioned. And so self-awareness training is really taking the time to stop and think about the present day problems that a person might be having. And so we do that in a couple of different exercises through the program. One way we do that is to divide the difficulty someone is having into organizational skills. So that's, you know, if you stop and think about problems you might be having related to being organized. The second category over here on the left is disease management. So this is where you would think about issues you might be having related to managing your seizures, things like taking your medicine on time or getting enough sleep, making sure you're eating well and exercising. And then the third category revolves around more social skills. So problems that a person might have related to their memory when they're out and about with other people or in public places. So things like not being able to remember names or conversations, those sorts of things. So once you go through and you've identified with your coach these different sort of categories of problems, you're going to be assigned some homework for a week to take home to keep what's called a memory and attention problem experience record. And with this record, you're going to briefly describe different problems that you encounter during the course of a week, how much any specific problem bothered you on a scale of 1 to 10. And then you're going to record what was happening at the time you had the problem and what you were feeling at the time. So those external factors like distractions and those internal factors like feeling anxious or tense or hungry, those are the sorts of things you're going to note. And you're going to bring that back during the next week of your program and review it with your coach. And you're going to look for times of high risk. So is it that you seem to have more trouble with your memory when you're feeling anxious? Or is it that it's really bothersome to you and makes it more difficult for you to make new memories if there's a lot of distraction, like sound or noise? You'll look through the sheet with your coach and you'll look for any patterns underlying your specific memory or thinking problems. And in that way, you'll use the self-awareness training to help direct the course of your Hopscotch program. It's very individualized. You're the one who's going to drive the program with your present day problems. Next, once you've figured out the types of problems that you are having, you're going to go ahead and build these cognitive skills around problem-solving therapy. So as we said, it's a type of cognitive behavioral therapy, and it's applied to life problems with both psychological and physiologic symptoms, memory being one of them. It's based on a model of stress and well-being that takes into account the importance of real-life problem solving. And it helps people to see problems as challenges to be solved instead of obstacles they can't overcome. And what you'll learn as you work with your coach in this program is there's a lot of room for creativity, skill building, and effectiveness in problem-solving therapy. And I share this image with you because I saw it, it made me smile, and it made me think about problem-solving therapy. So, and I happen to love crosswords. So this person was extremely creative in solving this problem. The boxes in their crossword were not lining up the way they wanted them to. So they simply took their whiteout and made it easier for them to fill out their crossword. So that's just, you know, a metaphor for the need to think creatively and do what you can to think outside the box for solving problems. And Hopscotch lets people do that. So problem-solving therapy, I'll tell you a little bit more about it. You'll hear a lot more about it from your coach if you decide you're going to try this Hopscotch program. Essentially, there are 7 steps to the program. And we all know memory, attention, and other problems cause frustration and increased stress. And this is meant to help you feel more in control of your day-to-day cognitive problems. So the way you're going to do that is you're going to first define what the problem is. And once you've done that, once you've narrowed down what the problem is, you're going to set a realistic goal, something that's achievable for you to attain in the course of the week, and something that's measurable. Once you've done that, once you've set your goal for the week, you're going to brainstorm solutions. So how are you going to reach your goal? And this is where the creativity comes in. You can be as outside the box as you want to be when you're brainstorming solutions. You're not going to judge any of them to begin with. You're just going to record them. Now, once you've done that, you're going to go one solution at a time and weigh the pros and cons for each of those potential solutions. And at the end of the process, you'll choose the solution that seems best, and your coach will help you to develop an action plan, a step-by-step plan for you to carry out that solution. You'll go off for the week. You'll apply your solution to the memory problem that you're having at home. You'll keep track of if it's helpful or if there are barriers that aren't letting you apply the solution. And then you'll come back, you'll meet with your coach the next week, and you'll review your progress. So let's talk a little bit about the memory toolbox and compensatory strategies, another important component of this program. And so compensatory memory strategies, you'll remember, are the tried and true strategies. And they're behavioral strategies designed to help people overcome problems with attention, memory, things like planning and other executive functions, as well as other cognitive skills. And you can see a long list of these strategies will be available to you in your toolbox to work through with your coach. And we're going to get a taste of some of these tonight. We're not going to go through all of them, but I wanted you to get a sense for what these are. So memory routines are one type of strategy, and essentially they are a strategy whereby a person does things the same way to prevent things or steps from being forgotten. They are incorporated into daily routines, and much like a high-level athlete, practice, patience, and more practice allow for memory routines to become effective for you. I want to give you a case example of this. So Margaret is a 43-year-old woman, a hospice nurse, and in her job, she performed patient intake assessments in different long-term care facilities. And she might travel to 3 or 4 different facilities in a day as part of her job. She'll drive from one to the next and see patients in each of the facilities. And the problem she was having, she was able to share, was that she was incredibly frustrated and embarrassed often by having to spend time searching for her personal items, so her purse, her water bottle, her keys, after completing her evaluations. So what she had been doing was going into these different buildings and just setting her things down, either at the nurse's station or outside the patient's room door, or wherever she could find that seemed like a good place to leave her things at the moment. She'd go in and she'd do her evaluation, and then she'd come out and she felt like she was wasting precious time searching and searching for her things, and would often feel embarrassed at having to ask other people. She simply couldn't remember where she had set her things down. So the solution she chose after doing her brainstorming session was to find one common work area, and in this case, it was a designated staff lunchroom, to leave her personal items. And it didn't matter which of the buildings she was in, because each of the buildings she went to definitely had a staff lunchroom. So she was able to implement what she called a life-changing solution simply by each time she went into one of her buildings to do her work, taking her personal things and leaving them in the staff lunchroom as opposed to other places. And that way, she was more in control of her memory. She didn't have to remember each time she walked outside of a patient's room when she was done her intake where she'd left her things. And she was so pleased for saving the time and saving the frustration for herself. Another strategy that it is part of this program is something called the mental walk. And the mental walk is actually a tried and true strategy that dates all the way back to ancient times. So stick with me here. This one's a little bit trickier to think about. And so it's a visualization strategy that helps people remember lists of words. And it can be used as a way to remember things like a grocery store or shopping list, a list of errands someone might have to do, or new material if you're taking a class or a course. And it was originally used as a learning skill in ancient Greece before inexpensive paper was manufactured, so students could take notes. So they needed to think of ways to be able to remember things because they couldn't take notes. So using the mental walk is relatively straightforward. Essentially how it works is you start by picturing a familiar space with different rooms. And for most of us, that would be our home. So you could imagine yourself walking into your front foyer, then walking into your living room, then walking into your dining room. You can sort of visualize that pathway in your house very well because you do it all the time and you know where things are. So once you've done that, the next thing you're going to do is in each room, picture each of the objects or items you want to remember. And for this example here on the right, we have items that are on a shopping list, and they're grapes, chicken, and an apple pie, or a cherry pie, I guess, because it's red. And so what you do is you take those items that are on your shopping list and you place them in your mind. You visualize these things in this very well-known pathway to you. So for this person, they placed the item grapes in their foyer, chicken in their living room, and cherry pie in their dining room. And so when they do their mental walk, as they're walking through their house, they're taking their normal path from the foyer to the living room to the dining room. They're remembering each of these items in this room. A way to enhance how you remember things doing this is to take those items and make the image of those objects absurd, because we know adding emotion to a memory can make it stick better. So instead of just imagining some grapes in the foyer, imagine a giant bunch of grapes up to the ceiling in your foyer. And imagine 100 chickens running around your living room, and a cherry pie the size of your dining room table in your dining room. And then head off to the store. When you're at the store, what you'll simply do is walk through your house. So you think about going to your foyer. Oh yeah, you can remember, that's right, that's where the giant cluster of grapes was. Then you'll walk in your mind to your living room. That's right, there are 100 chickens running around my living room. I need to get chicken. And then finally into your dining room, where you see that giant, or you visualize that giant cherry pie on the dining room table, and you pick up your cherry pie. The most important point in using the mental walk is to use the same memory space, like the rooms of your home, each time you remember a list of objects or items or names. And for most people, like I said, it's their home that they remember well. So use that familiar space over and over again. Most people start by learning to do this with 3 or 4 items, but as people get better and better at it, they can remember a list of up to a dozen items. So that's another tried and true memory strategy, which has been around since ancient times. Reminders. So reminders are a great memory strategy. A reminder is an external cue, and it's a type of memory aid. So it's a reminder to do something important. And the memory strategy that you'll walk through with your coach gives you some suggestions for using external cues or reminders. They help to take advantage or getting to know your daily schedule and situations, times when paying attention or remembering is a problem. You'll need to leave yourself a reminder for. You identify the situation, and then you can see if something like a note or a sign or an auditory reminder like a beep on your phone is the best thing for you to use. You want to keep your reminders pretty simple, so you don't want to have 300 sticky notes on your fridge door, because it'll be impossible for you to remember while they're there. And you want to take stock. So if the reminders don't help you, change them. You want to keep them both easy and useful. And I'll give you a quick case example here of David. So David was living with epilepsy, and Ellie, his sister, was his primary caregiver. And they're siblings who share a home. David works as a custodian in a local school, and Ellie was retired, but really a very, very active person, out and about in the community, going out to lunch with her friends, very involved in her church. So she was often out of the house. And the problem the two of them were having was that David was feeling very anxious, forgetting where his sister had gone and when she would be home. So if he would get home from work in the middle of the afternoon and Ellie was gone, even though she may have told him in the morning, he wouldn't remember. And the opposite was also happening. So if Ellie was out with her friends and doing different things, out shopping, whatever she was doing, and she got home at 3 in the afternoon and he wasn't there, and normally he should be home at 2:30, she would worry. She would worry he'd had a seizure or he hadn't come home from work for some reason. And so it was causing a lot of tension and stress between the two of them. They both shared that neither of them were particularly good about carrying or using cell phones. And they tried, sticky notes in different places around the house, hoping that David would find them when he got home from work, but it just wasn't working consistently. So the solution that they ended up choosing as a reminder was to set up a notebook with an attached pencil on a small writing table by the only door that they had used to exit and enter their home. And by doing that, each time Ellie went out, she'd simply write on a line, gone to the store, back at 6, or David, when he came home from work, if he went out to walk the dog, he'd write, out with the dog, be back in 30 minutes. And in doing that, in setting up that reminder solution, they completely took away the frustration, the anxiety, the tension between the two of them. It was a permanent visual reminder for the two of them. They couldn't possibly get out that door without seeing the notebook and without writing a little note for the other person so that they could eliminate worry for them. Again, it really just took the time of sitting down, thinking about what the issue was, doing some problem solving and coming up with a solution. And the two of them, again, both describe this as life-changing. I want to share with you that quick relaxation. Samantha said that you'd be receiving some MP3 files with relaxation on them. During the course of this program, quick relaxation is very important. These mindfulness exercises of progressive muscle relaxation and breathing exercises can be very, very helpful at helping people to relieve stress and aiding them in improving their memory and thinking. I want to just briefly share with you that we're continuing to build digital tools and a community around Hopscotch for access to the program, for education about memory and epilepsy, for support with peers, and for connecting both to us at HOBSCOTCH Institute as well as people locally in your state like Rena and Seamus, and with others who participate in the program. We're I want to share with you, there's a Hopscotch website where you can find more information about the program and resources. We're also working on, and in the testing phase, we have a Hopscotch app for telephones, and we're really excited about this. It'll provide people with a daily log reminder so that they can input whether or not they've had a seizure, what medications, whether or not they've taken their medications for the day, whether or not they've used a memory strategy, and just generally how they're feeling. It provides you with a calendar so you can see which days you've done your recording on and which ones you haven't. You can see that it inputs your responses and saves them. It also leaves you a place where you can, if you have some notes to leave for yourself that you may want to share with your doctor or with your memory coach, you can do that. So we're really excited to be able to share that with everyone soon. Finally, I want to just share with everyone the most important thing about Hopscotch, and that is that it helps people, and we know it helps people. The science shows us that, but so do the words that we've heard from so many people that have participated in this program. And the thought shared here, I hope this program continues to thrive and touches people's lives in the positive way it has for me. It was a true lifeline for me in a time of deep crisis. Everybody has a story, and now Hopscotch is a part of mine. Comes directly from one of our Hopscotch participants. And we hear this over and over again with people who have gone through the program, that the program really provided them with a sense of control and a higher quality of life. Finally, I just want to share with you at the HOBSCOTCH Institute, we have a big team that's continuously working to disseminate the program, to make improvements like the app, and to make sure people who want to take part in the program are able to. And with that, I want to thank Rena and Seamus again, and we welcome you to reach out directly to Rena and Seamus, of course, first, but also to the new programs through our new programs email to Samantha and myself. If you have questions that you'd like for us to answer for you, we're always available to do so. So thank you again. I want to thank my colleague Samantha for sharing the presentation time with me, and thank you to Rena and Seamus.
Great. Thank you very much, Elaine and Samantha. Really appreciate you taking the time tonight. And that was a really great presentation. Just want to show everyone real quick, if you have any questions or are interested in the program at all, please, I will be the main contact. You can reach out to me by email or phone, but if some reason you can't get a hold of me, I promise I will be quick at responding, but if for some reason, again, you can't get a hold of me, you can also reach out to Rena by email or her phone number that you can see below. At this time, I'm going to launch a poll, and if you could please just take a few moments to fill this out, it will be greatly appreciated. If for whatever reason it's not popping up or you're having some technical difficulties, please don't worry about it. All right, and we're also going to have some time for a quick Q&A. So if you have any questions, please submit them into the chat box. And Elaine and Samantha, it looks like we have a couple questions. The one is, have they considered starting hopscotch at a younger year, like for teenagers to prepare for adulthood?
Yes, so that is on the horizon. We're very interested in offering this to teens. And we're happy to work with teens with their parents too. So if you have a 17, 18-year-old who you think might be ready for a program like this to help them either organize or manage things like their medications or sleep, anything at all, and you'd like them to participate, please reach out to us. And we're happy to work with you to make that happen.
Okay, great, thank you. And then another question we have is, have you heard of vision therapy to help with cognition and learning disabilities? Is there any evidence for this?
I'm not sure specifically what you're referencing, so I'm not going to answer that question. There are so many different kinds of cognitive therapy. I'd have to look carefully at the program that you are referencing, but I'm happy to answer your question by email.
Okay, great. Thank you, Elaine. And then one more question that we do have is, do people get turned away if they don't meet certain things like frequency of seizures?
So the answer is no. We have patients who have been seizure-free for years, and we have patients that have fairly regular seizures who are still impacted by uncontrolled seizures. This is a program that's adaptable to different needs, and we know that even if your seizures are controlled, for many people there can still be cognitive or thinking issues that accompany their epilepsy. And so it's a program that's really for anyone who's motivated to participate in it.
Okay. Oh, wonderful. And then another question that we have is, they said, I found the app on my phone. Is it possible to sign up now?
So because we're in the beta testing phase, no. But as soon as it becomes available, we will definitely let people know. So we would let Seamus and Rena know so they could implement it with people who were doing the program with them. So as they were coaching them, they'd be able to provide them with a key so that they could use the app.
Great. Thank you very much. So it looks like that's all the questions that we have for tonight. But again, if you have any questions moving forward, you can reach out to me by email, phone. You can also reach out to Elaine, Samantha, and or if you want to reach out to us, and we'll make sure we can get in contact with them as well too for any questions or concerns that you may have. I want to thank everyone for joining us tonight, and also a big thank you to Elaine and Samantha for taking the time and presenting tonight.
And Seamus, I just want to say I did see one question pop up about cost. There's no cost to participants to take the program. So if you're someone that would like to enroll in the program, you don't have to worry about paying to do so at this time. It's available to everyone. And I'll just echo your thanks to our audience and to your wonderful community, Seamus. It was great to be here with you all, and I want to thank you for your attention and your interest in the program. Your questions were great.
Great. Thank you very much, everyone, and we really appreciate it.
Thank you guys so much. And we'll be sending out the recording tomorrow. So in case you missed any of it, you will have the recording to review. All right. Good night, everybody. Thank you so much.
All right. Good night, everyone.
Thank you.